Ahlan wa sahlan. Welcome everyone to this session. I am very happy to be able to give this session today in this beautiful virtual health and fitness festival. Big thank you to the Abu Dhabi Center for Technical and Vocational Education and Training. And a big thank you as well for the Abu Dhabi University College of Health Sciences, where I am an adjunct instructor. My name is Chagoury. I'm a clinical dietitian. I'm also a health behavior educator. I've been practicing nutrition basically for 17 years in the UAE. I am very happy to share with you today some of my knowledge and my experience in immunity and nutrition and the relationship and the interaction between immunity and nutrition. I hope you find this session useful. I will make sure to finish 10 to 15 minutes before the hour so that you can ask and I can answer all your questions. I know you might have some questions. I'm sure many of your questions will be answered during the session. And otherwise, please feel free to just put your questions and I will be more than happy to answer it in English or in Arabic, whatever you prefer. However, the presentation will be in English for now. So let me share my screen with everyone and let's get started. There you go. All right, so as you might imagine, the topic of immunity in the clinic nowadays has taken over actually overweight and obesity and weight management. People are visiting dietitians and healthcare providers more and more to know about what are the foods that can help with boosting their immunity, what are the foods that they should avoid for their children and for themselves. Hopefully by the end of this session, I will be able to answer a few of your common questions, such as how is children immunity developed? What nutrients affect my child's immunity the most? What nutrients play a role in adults' immunity and vaccine responsiveness? What foods are good sources of these nutrients? Who need to be supplemented? Is sugar really as bad as people say? What's the relationship between gut health and immunity? And are there other health habits other than food that can boost the immunity? If we have time, I will be doing a small lunchbox 101 or just some tips on how to prepare healthy lunchboxes for the kids who are going to school and even lunchboxes that they can use while studying at home. So in a nutshell, immunity has many factors that affect, there are many factors in our body that affect immunity from children to adulthood to older age. The most important factors that we always hear about are good sleep, hydration, nutrients, and that is divided into macro and micronutrients, hygiene, gut bacteria, and play and exercise. And this applies equally to adults and children. And this is what we will be going over today. I just wanted to show you this, this diagram and how complex it is for you to have an idea of how complex immunity is when it's in relation to our lifestyle, our nutrition. If you look here at the compromised immune function, you see the arrows coming to it. So from sleep disturbance to prolonged excessive exercise, and that we will tackle in a bit. Chronic stress, obviously, like most of you know, pollution, cigarette smoking. And then you have here what we will be discussing the most today, which is suboptimal nutritional status. It means someone whose nutrition is not optimal, and we're not talking about people who are have severe deficiencies, or necessarily people with chronic conditions. We're talking about people with suboptimal nutrition status, and it could be me and you. It could be anyone who hasn't been paying attention specifically to what diets they're following, whether or not they're being sedentary or active, a hectic lifestyle, ordering more than usual fast food, and obviously lack of fresh, nutritious food. Now, immunity, just to briefly explain it, especially to parents who are watching, because this is very important. It sticks in our brain and we remember it every time we're dealing with illness or food and immunity with our children. Immunity usually is divided into two. It's divided into the innate immunity and the acquired immunity. So the innate immunity, obviously, I'm not going to go into the details of immunology. This is not my area of expertise. I just put this diagram for you to see, this chart for you to see how things are connected. So part of our innate immunity, or the immunity we are born with, is the anatomical barriers, which is the mucus, which is the lining of our stomach, the skin, gut health. All of these things are part of our immunity. And now when I get to the nutrients and I explain why it's important to keep healthy guts, you will understand better how the guts are related to the immunity. Now, this is the innate immunity. So the immunity that we're basically born with. And then there's something that we call acquired immunity. The acquired immunity is divided into two parts. The active immunity, which is basically if we get sick or the children get sick, or if they get vaccinated. So these are two acquired types of active immunity. This is, for instance, a big role is played here by the playing, touching and eating the food and being messy with the food, getting sick and getting back again. This is part of how the child develops the active immunity. As for the passive immunity, and the part what is interesting to us, is the natural passive immunity that is also transmitted from the mom to the child, whether through birth or through breastfeeding. And this is why we always recommend at the top of our recommendations, whenever we're talking about nutrition and childhood immunity, breastfeeding. It is crucial to be able to breastfeed a child whenever we can, because we give antibodies to the child through the breast milk, and this type of immunity that we call natural passive immunity can last up to 5 years with the child. And then the other artificial passive immunity has to do with pharmaceuticals. Also, we will not tackle it. Now, how can I work on both strengthening this innate immunity and also making sure that once the natural passive immunity has expired with my child, he or she is equipped enough to be immune or to fight off or be resilient to diseases? What do we need in terms of nutrition? And this is what I'm here to talk about. We need immuno-nutrients, which are nutrients that are known in the research and in the scientific field to provide a sort of an immunity. Second, gut health. And I always talk about microbiome and gut health, and we will go over practical tips today. And macronutrients, which are carbohydrates, protein, healthy fats, and water. Immunonutrients being the micronutrients. So this is for children, but it also applies to adults. And this is a very detailed table of what are the things that actually affect parents, adults, mainly in terms of immunity. Again, I'm not going over all of it. We're going to discuss mostly lifestyle or behavioral factors and nutritional factors, of course. So linking both together, if we link the children's immunity with the parents' immunity and the needs, it all comes down to these elements. So what do we need the most? We need the most, if you look back at the table, immunonutrients in pink: vitamin C, iron, selenium, vitamin D, vitamin A, and zinc. These, we call them the superstars of immunity. And then next we have, if you go back to the table, gut health in blue. So we have probiotics, omega-3 and prebiotics. And then in the last one would be the macronutrients: protein, water, carbs, and fat. And obviously you see here, I have put in purple sleep and activity, because we can't talk immunity, we can't talk health without dwelling and emphasizing the importance of sleep and activity. Now, first things first, I always like to start with hydration, because I think this is the most underrated habit, or the most underrated nutrient when it comes to adult and children nutrition. We have to be well hydrated, and we have to hydrate with water, and we have to hydrate with the proper fluids. And again, I'll be going over what types of fluids I mean. Now, a very important thing to know here is that 50 to 70% of children and adolescents are already dehydrated before they request water. So if you wait on a child to ask for water, chances are the child is already dehydrated. And the symptoms, like most of you know, thirst, starts with thirst, and then irritability, fatigue, weakness, nausea, headache, muscle cramping, and it can go all the way to dizziness, lightheadedness. And then we'll go over the urine color and how we can determine the level of hydration with the urine color. Now, I always recommend my patients, just like you tell your child it's cold outside, put on a sweater, because a child can be running for 3 hours in a 10°C environment and not even notice the cold. So we will, just like we tell them, this is a jacket, it's cold outside, we have to tell them, here, drink water, you might be thirsty. And anyways, if you experience it, if you experiment with it, notice that you never give a child water and unless he has a bottle with him or her, and he would tell you, no, I'm not thirsty. That's because they are not fully aware of the need to drink and the thirst signals. This is just signs of dehydrations with adult and infants. And this is what I wanted to get to regarding the color of the urine and the level of dehydration. Ideally, we want to reach with ourselves and with our children a transparent color of urine, which means you're fully hydrated. And as it goes darker, the dehydration increases. So if you see your child's urine color amber or honey, chances are the child is not getting enough water. We need it to fluctuate depending on his or her level of activity between transparent yellow to no color and transparent, and make sure we always check the color of the urine or teach them or train them to look at the color of urine, especially in warm months. How much water do adults need? Well, it really ranges. The range is too big. It's you know, if we gather research, it's between 2.7 to 3.7 liter for men, between men and women. Women at 2.7 and men at 3.7 liters, and that includes not only water but also herbal teas, juices, and food. It excludes caffeine-containing drinks, because caffeine-containing drinks are not your source of hydration. If let me just share this with you, and I'm sure most of you know or are familiar with this chart of the caffeine content. And the reason why I am addressing caffeine here is because caffeine is known to dehydrate. So it is not a hydrating drink. When you drink caffeine or caffeine-containing drinks, you have to compensate that with fluids that hydrate. So just to go over this chart quickly, we start at the decaf coffee, it's 3 milligrams per cup. And then up to the brewed coffee that can be up to 95 milligrams of caffeine. You have the energy drinks at 80 milligrams, the soft drinks at 40 milligrams, and then the black tea is at 45 milligrams. Green tea, if you notice, is at the lower end. Hot chocolate, on the other hand, which is a common drink for children, contains a good 20 milligrams of caffeine. So we should always keep in mind when they're having caffeinated drink to compensate it with water. Now, the other thing that is very, very important, and I mentioned that here in terms of caffeine content, energy drinks, and this trend that we see with young adults and teenagers and adults equally with energy drinks. And I see many adults who actually have a can of energy drink in the morning as a breakfast just because it contains caffeine. Well, the amount in this can of energy drink is around 220 milligrams of caffeine, which is slightly above our daily upper limit. And guess what? We drink it cold. And when you ingest something cold, the absorption in the body is much higher. So imagine now a child or an adolescent taking this amount of caffeine cold. So first, we drink it quickly. It doesn't take an hour like a hot coffee or 30 minutes. We drink it quickly and it gets absorbed quickly. And the effect of caffeine on the heart, on the focus, on the hydration for children and adult is not recommended at all in this amount and this speed. So why am I talking about caffeine while we're discussing immunity? Is because caffeinated drinks and sugary drinks equally are highly related to our physical health. And then our physical health determines our level of immunity. Just quickly to show you how much sugar there is in these two drinks, one of them has around 10, 11 spoons and the other equally of sugar. And these are drinks that some kids or some adults take not occasionally, regularly. And in a bit, I will show you some research. Here it is, some research about the increased intake of soft drinks, even diet soft drinks, because the other trend is, okay, I will not have the regular soft drink because it contains sugar, so I'll switch and I'll have my children switch to the diet soft drinks. It's a no-no. There are tons of research now done on diet soft drinks specifically that are linking the intake of diet soft drinks, regular intake. I'm not talking about, you know, that soft drinks, diet soft drink you have occasionally. I'm talking about people having regularly 1 or 2 every day. Increased risk of obesity and metabolic syndrome. When we say metabolic syndrome, it means increased blood lipids, risk of diabetes, insulin resistance, high blood pressure, 2 or 3 of these symptoms. Increased appetite by stimulating hunger hormones. You'd be surprised because you would think, okay, it's I'll have a diet Coke diet soft drink so that I don't eat or I don't, or you know, it cuts my appetite. The chances are, few minutes or a couple of hours later, your hunger will spike because of the changes in hunger hormones. And we're not going to go into details in the physiology of it, although I would love to, but this is not the scope of this session. Increases in type 2 diabetes risk. And what matters to me the most here is the relationship with the gut flora. I always talk to my students, to my patients, wherever I go, I'm carrying the gut flora agenda with me because it is so important. It has been linked to so many functions in the body, and we don't want to mess with the gut flora. We don't want to get our healthy, good bacteria in our guts angry or upset or hungry. So diet soft drinks have been linked to altered gut flora. When we say altered, we have a certain balance of healthy bacteria that we're supposed to have in our guts. When we say altered, it means either the numbers or the quantities have been reduced, or the strains, so the number and the types of bacteria that are in our guts have been compromised. And in order for us to be to use this gut bacteria or to be benefiting from it, we need both quantity and different strains, because each strain does something. Some work on immunity, some work on mental health and brain development, some work on obesity and overweight. So basically, we need to keep this bacteria happy, and diet soft drinks don't do this job. Pregnant women who consume diet soft drinks are at higher risk of delivering preterm babies, and increased risk of osteoporosis, specifically in women. There are tons of research linking low bone mineral density with the intake of soft drinks in women. Now that we covered hydration, and if you have any questions, I think we might have some, but if you have questions regarding hydration and I didn't cover, please feel free to put them. I will also make sure I'm on time with all the to answer your questions. The second thing we will cover is the macronutrients. No, actually the micronutrients. We're going to discuss vitamins specifically. So just for your an idea as well. So nutrients are divided into macro and micronutrients. Macros being proteins, fats, and carbohydrates, and I put water here always. Micronutrients would be minerals and vitamins. And even within minerals and vitamins, we divide them into macrominerals, trace minerals, vitamins. Again, we're not going to go into that. The first group I'm going to discuss now are trace minerals and vitamins. Vitamins are also divided into 2 groups. The reason why I like to do those diagrams and divide things into groups, because I believe it makes understanding easier, and you can relate it to everyday's practice in a better way. And I'll tell you how. Vitamins are divided into 2 groups, as I mentioned, water-soluble and fat-soluble. The water-soluble vitamins are B and C, and the fat-soluble are D, E, K, A. An easy way to remember it is to remember a deck of cards, or DECA. Now, B and C are water-soluble vitamins. How is this important for you to know? You know, what difference does it make if it's water-soluble or fat-soluble? 2 things. First of all, keep in mind, water-soluble vitamins are soluble in water when I cook. So when you overcook foods that contain water-soluble vitamins, chances are those 2 vitamins, B and C, will be lost in the cooking process. So you have to think of more efficient way of cooking, not to get rid of those, such as a pressure cooker or steaming, rather than boiling and cooking again. The other reason why it's important to know is that when you want to take supplements such as B and C, you have to take it in dosages and divide it. If you have 2 pills during the day, it's better to divide it into different, like morning, lunch, and evening, and not take it at one go, because the body cannot store water-soluble vitamins. We can only store fat-soluble vitamins, hence the reason why I said here, fat-soluble vitamins are okay if we take them at one go. For instance, you notice vitamin D is given either daily or weekly or monthly or sometimes an injection every 3 months, because our body is able to store these vitamins, these fat-soluble vitamins, and release it whenever we need. Which means also another very important thing, and this is highly related to immunity, is this link between low-fat diets and the continuous dieting, random dieting, fat diets that cut down on most of your fat intake, and deficiencies in immunity. So I see a lot of people who continuously go on low-fat diets and who have very high deficiencies in, specifically in vitamin D, because now we tested more than other vitamins, but also we see clinical signs of deficiency in vitamin E, K, and A. Now, specifically vitamin D is highly related to immunity, and recently we've seen so many research linking vitamin D status and a complication with COVID-19 cases, vitamin D and immunity, vitamin D and metabolic diseases. So sorry, I think something is, okay. Excuse me, can you just cut down my voice because I can hear myself? Okay, so moving on, we spoke about the B and C and the fat-soluble vitamins. Where do we find them? And this is the big question. Where do we find vitamin D and vitamin A and K and all of them? I'm going to mention the main ones, that the immuno-nutrients that I mentioned right here, which is D, A, C, K, and vitamin A, so that we don't, take a lot of time, so that we stay focused on immunity. So vitamin A contains carotenoids, which are known to be phytonutrients that increase the body's production of white blood cells. And we know that white blood cells are the ones that fight off infections. So it's very important. It's a very important vitamin that we have to keep in mind. An easy way to remember vitamin A is orange or reddish. So everything that is orange, like carrots, like sweet potatoes, like pumpkin, peach, oranges, sweet pepper, and also spinach, which is green, but it's also pretty rich in vitamin A. All of these are very important immune boosting nutrients, and it's important to put them in our diet and in our children's diet. I would just to give you an idea, it's very easy to reach vitamin A levels. We don't need supplementation with vitamin A. A medium raw carrot would give you 200% of your daily needs in vitamin A. A medium cooked sweet potato would give you 400 times our needs. We don't get intoxicated from higher level of vitamin A from food, but yes, vitamin A supplementation has to be taken only when needed, and it's not usually a routine supplement that we give. Moving on to the favorite vitamin of all times, and nowadays people are much more and more aware of the importance of vitamin D. I just put this to give you an idea of the content of vitamin D and our needs. So the recommendation is to be taking between 400 and 600 IU per day of vitamin D for those who are not suffering from any deficiency, who have optimal levels of vitamin D. Just to give you an idea, 90 grams of cooked salmon would give you 450 IU. Okay, remember 600 to 800. The recommendation is actually 400 to 600. Now they're raising it up slightly to around 800 to 1,000, right? So this has 450 IU. A cup of fortified orange juice would have 137. Fat-free milk around 115. Yogurt, a small jar of yogurt would have around 80 IU. Now, you would tell me, fine, it looks easy to reach that. If you do your calculations and you're having daily a good source of vitamin D, it is easy to reach the 600 or the 800 or the 1,000 even if you're really well planning your diet. The problem is many of us don't eat those foods regularly. And the other problem is many of us don't have optimal levels of vitamin D. So if you have a suboptimal And when I say suboptimal, I don't mean 20 and 19, below 30, right? Because 30 is the healthy, above 30 is the healthy range when it comes to when you're doing your blood test. Now, optimal levels to fight off infections and help with your immunity is above 50. So when I say suboptimals, 30 could be suboptimal, 35 is suboptimal, and most of people I encounter in this part of the world are deficient or suboptimal in vitamin D. This is why we always recommend regular intake of supplements, and you'll get to that in a minute. Who is most at risk? Vegans, people with lactose intolerance or allergies, cow's milk allergies, reduced exposure to sunlight, because we know it's the sunlight that transforms or converts vitamin D in our skin from cholesterol. People who are on certain medications, such as anticonvulsants, overweight or obese children and adults are at higher risk of deficiency. The theory is that vitamin D is held or stored in our fat cells, and when with overweight or obese individual, it's not bioavailable. So even if they have enough vitamin D, it's not available for their uses. Like I mentioned, according to the American Association of Pediatrics clinical report, infants under 12 months require 400 IU per day and older 600 IU per day, and this dosage still stands even with supplementation for children. For adults, like I mentioned earlier. Now, vitamin D insufficiency, as mentioned, has been linked to many diseases such as influenza, tuberculosis, autoimmune diseases, cancers. There's a link between vitamin D deficiency and certain cancers, myocardial infarction, and recently we've seen so many studies that linked vitamin D, suboptimal vitamin D, to a complication from COVID-19. The question is, do we supplement children with vitamin D? The answer is easy. If your child is a child that eats seafood, that eats fish, that eats all of the food I mentioned above naturally and daily, and has no issues with that, is not vegetarian, and is not deficient in vitamin D, we don't need to supplement. But if your child is deficient or falls into any of those groups that I mentioned earlier, or doesn't eat much of those foods, then yes, we have to supplement vitamin D. Obviously, we check with the pediatrician for the dosage, or the dietitian, the clinical dietitian. This is a small note for you regarding vitamin K2. It applies to adults, not to children. Now, there are recent research that are recommending the intake of K2 whenever you're taking supplements of vitamin D, and you find now combined vitamin D3 K2 supplements, because K2 is thought to help use calcium efficiently, because the vitamin D main function in the body is to help the calcium feed the bones, if you want. So it distributes properly the calcium within the body. Now the K2 helps even more because it directs calcium into the bones and away from the arteries, because there were some research that linked an increase in vitamin D intake and calcium intake and an increase in calcification or atherosclerosis. So these two can be prevented if we take vitamin K2 along with the vitamin D. Obviously, you have to check with your physician because it does have some counter effects with some medications you might be taking. Vitamin C is the easy one. Vitamin C, everyone knows where we can find it. Here's just a picture for you to see. It's in broccoli, tomatoes, kiwi, strawberry, and citrus fruits. And most fruits and vegetables, in fact, contain some levels of vitamin C, but these are the richest. The upper limit, which means the maximum we're allowed to take in supplementation, I put it right here, 400 milligrams for children, 1,200 for older children aged 9 to 13, and 2,000 milligrams for adults. So I know people who have been taking 5,000 and 6,000. It means 5 grams or 6 grams of vitamin C. We have to be very careful with the amounts we're taking of most vitamins and minerals, because most of them have upper limit and have upper tolerable limit above which it can pose risks to the body and become toxic. I think I'm good on the time. Let me just check if I'm okay with the time. Yes, we're good. Moving on to the trace minerals. So like I told you, we have the micronutrients, under which we have the vitamins that I just went over, the few ones related to immunity, and we're moving on to the trace minerals. I'm going to go over 3 of them. Selenium is quite now a popular supplement among parents supplementing children and in the adult community as well. It's very easy to get it from food if we know the right sources. And this is a picture just to give you an idea. It's mostly found in animals, in animal products. But Brazil nuts, for instance, are one of those super nuts, whereby only 2 Brazil nuts would give you all your needs in selenium. So what I recommend usually is to give children a daily 1 Brazil nut that could be mashed or grounded with their food without them knowing, with their smoothies, with their yogurt bowl, with their soups or stews. It does make a big difference when it comes to immuno-nutrients, and it's easy to provide it. It's just 1 Brazil nut that I can ground it and add it to their food. Zinc is another important mineral when it comes to immunity for both adults and children equally. Just to give you an idea, 1 cup of cooked beans has 1 cup of cooked beans and 100 grams of red meat could give you all your requirements in zinc. When it comes to children's requirement in zinc, it is more or less around the same thing. This would be fine. We rarely give supplements for children of zinc. Obviously, we have to check with the pediatrician if there's a need. Only again, if the children is a very picky eater, or if they follow specific diets or have major deficiencies. One thing to note is how to increase bioavailability or availability of zinc, especially in vegetarian sources. If you soak nuts and seeds and legumes, beans and lentils overnight before cooking, it does improve the absorption of zinc when we consume them. So that's just a tip. And also because vegetarians tend to absorb less zinc from the vegetarian sources, their requirements are slightly more than what I mentioned here. Iron is iron. It's an essential nutrient for immunity and health and general health in general. Just one note here regarding these are the foods that are rich in iron. We all know that most of the highest levels of iron we can find in animal products, mainly red meat and organ meats. But vegetarian sources and vegan sources do have iron, like broccoli, like raisins, like watermelon, dried beans, lentils, spinach. All these contain iron. One important information here is that because iron is less available from vegetarian sources, it's very important to add to it a source of vitamin C to increase absorption. So you saw the vitamin C here before when I went over them. So just an orange or a squeeze of lemon or a strawberry, kiwi with the iron source would increase absorption. We need to take special care when it comes to girls around menstrual periods, pre-puberty and puberty, because young girls and young women are at higher risk of iron deficiency anemia. Omega-3 is definitely an anti-inflammatory type of oil that when taken in enough amounts and in enough ratio, in a good ratio with omega-6, it controls inflammation, and this reflects positively on our immunity. And of course, omega-3 is important for brain health as well. We can find it in all those foods: nuts, salmon, avocado, olives. Flaxseed is one of the richest source of vegetarian omega-3. So for people who are vegan, flaxseed is definitely a very good of omega-3 in our diet. Do we supplement? As in general, do we supplement? Well, definitely first source or first strategy is to go for whole foods, because when you're eating whole foods, you're not just extracting, obviously, the nutrients. There's tons of benefits that come from eating whole food, from phytonutrients, from satisfaction in consuming the food, from fibers, from macronutrients, and obviously from the micronutrients that I just described. So definitely your first go-to should be whole food. Like I mentioned, even enzymes and other components in food that is probiotic and prebiotic and so on. Now, unless your child or yourself fall in these category, we do not need to supplement. So athletic junior or adult, picky eater child, children with chronic medical conditions, children eating mostly processed food and processed diets because they don't like anything else but chicken nuggets and French fries, for instance, and chips and chocolates. Yes, we have to supplement. Vegetarian, vegan, children on dairy-free diets because of intolerance, dislikes, or allergies, children with iron deficiency anemia, with tested deficiencies such as vitamin D and others, eating disorders, kids and adolescents and adults equally, and menstruating teens and tween girls. Elderberry, which is the Sambucus nigra, has been also quite popular now with the supplements for immunity. What are the research on it? It is rich in immune boosting nutrients, including vitamin C and antioxidants. It does work as an anti-inflammatory in the body. There is not enough research linking it directly to an improved immunity or lower chances of contracting any virus. But it does have antiviral properties, especially against different strains of influenza virus. So yes, there may be some protective effects. Do we have an upper limit number? Do we have guidelines on the recommended daily intakes? No, we don't. But it's really up to you if you would like to, you can give just a small course of it in gummies or in pills. It won't hurt if it's limited time and limited amount. And obviously if the child or yourself don't suffer from any medical condition. Moving on to the biggest question, is sugar really that bad when it comes to immunity? The answer is yes. I just explained it here in 2 diagrams for you to have an idea why it is, why it can be affecting your immunity negatively. And again, I'm not talking about your occasional little piece of chocolate or the occasional sweet or snack that the child has. I am all for moderation, and I am all for no deprivation for children and adults. But it's important to note that when things are eaten in excess, especially sugar, yes, there is a price to pay. There are consequences. When you consume sugars, it enters your blood rapidly, especially fast sources of sugar. We're talking desserts and snacks and candies. This causes the sugar or the glucose levels in the blood to rise. Your body then hustles to process the sugar. So it's like a quick response that is required from the body. To process the sugar, your pancreas pumps a hormone that we call insulin to handle this amount of sugar. Insulin allows the glucose to leave your blood and enters your cell. This is in a normal, plan of action. And normally, if it's just once in a while, everything goes back to normal. Now, a constant high intake of sugar, it suppresses the immune system. Why? Because when your child or yourself are having big doses of sugar regularly, there's a process that we call phagocytosis within our immunity that gets suppressed by the presence of this increased sugar in our diet. So yes, on the long term, it affects immunity. And yes, on the long term, it affects our insulin response. Because if we keep giving high sugar to our children and to ourselves, the blood sugar will be dysregulated. The insulin response will not be as efficient. And as a result of this dysregulation, children can be overactive, adults can be cranky, it can lead to mood swings, and on the long run, it can lead to increase in body weight. And again, we know that an increase in body weight above the healthy levels is linked to lower immunity. So from different parts, sugar is related to immunity. This is a very important slide for you to see. Because when I'm talking sugar, obviously there's candy and biscuits and cookies. But if you look at the bottom of the iceberg, you also have bread has sugar. Cereals are a major source of sugar for our children. Pasta, some dried fruit have added sugar. Some fruit juices, some honey have sugars added to them. So yes, it is important to know where you're getting what we're talking about when it comes to sugar, and how you're choosing the ingredients in your children's food and diets. Moving on to gut health. So I did mention earlier the importance of the gut bacteria and the importance of keeping those bacteria happy in our body. And we're going to go slightly more into details now in the next few slides. Gut health, so the health of our digestive system, constitutes 75% of our immune system. It is that important. It is more than half of our immunity. So we cannot tackle immunity or talk about immunity without, discussing gut health and the food and how it's affecting our digestive system. Intestinal microbiota or gut flora or gut bacteria or healthy bacteria, or name it whatever you want to name it, they are a first line of defense. Remember when I told you at the beginning, we have first lines of defense or innate immunity? This is one of them. Inside the guts are about 100 trillion live microorganisms. Newborns are not born with the gut bacteria, but as they consume vitamin K, and if you have children, you know that some countries do give injections of vitamin K for children at birth, and this is to produce also, one of the reasons is to trigger the production of the proliferation of gut bacteria to help with the immunity. So inside the guts are about 100 trillion live microorganisms that promote normal GI, so normal gastrointestinal function, and protect the body from infection. And this population of bacteria is very sensitive. We should not take it for granted. It doesn't fix itself by itself. This is a bacteria that we have to feed, and we have to feed the right food. And not only we have to feed, we cannot attack this bacteria unless we need it. And when I say attack, and I'm addressing specifically parents here, we don't just toss antibiotic into our children's bodies every left and right. And when a pediatrician, obviously with due respect to all pediatricians, and no offense to any pediatrician, of course, but some pediatrician would recommend antibiotic as a first line because this is their responsibility and because they are, they want to handle whatever disease or illness is coming their way. But I urge parents to always ask a pediatrician that has just recommended antibiotic, is this really necessary? And if he or she says yes, then absolutely you have to give it to the child. But if he or she says, you can try and handle it for a couple of days and see how things go, then I promise you, give it a try, because one, it helps the child build stronger immunity, and two, it preserves those bacteria in the guts that are being killed by antibiotics. This is just a diagram for you to see how the probiotics form like a wall of defense in our guts. These, what you see here, are the layer, the internal layer. This is obviously a microscopic image, the internal layer of the intestines, and this here is the line of defense. Now, so probiotic is the good bacteria, prebiotic is the food of the good bacteria, and together they form something that we call symbiosis. So they orchestrate together to create this amazing immunity for our body. It's a potential symbiosis is now used as a treatment for many ailments, not just immunity, but there are research linking a symbiosis with brain health, with depression, with anxiety problems. So it is quite interesting and quite quite general, the reach of the benefits of probiotic and prebiotics. Probiotic, like I said, you can find it if you don't want to take it in supplements. We can find it in any food that is fermented: yogurt, miso, tempeh, kombucha, sauerkraut, kimchi, kefir. All of these are very rich sources of healthy bacteria. And to feed those healthy bacteria come the fibers, the fiber in foods known also as prebiotic, which is found in unripe bananas, asparagus, garlic, oats, nuts, legumes, leek. Onions are very rich in prebiotic, and artichoke. And again, do not overuse antibiotic to keep this balance. Just checking on the time. Okay, I will take another 5 minutes and then we can answer the questions. This is some slides I have used. Quickly, some non-food food immunity boosting tips. Sleep, essential. I'll go over it in a bit. Exercise as a family, especially for the children to encourage them. Hand washing. Okay, this is a question we always get. Aren't we compromising the immune system of our children by overdoing it with hand washing? Yes, definitely. Germs do increase immunity, but seeing the circumstances and the pandemic we live in, the reason why we're re-emphasizing hand washing is to reduce the stress on our children's immune system now, because we're already in a pandemic and we don't want at this point anything to bother the immunity of our child on the short term. I agree that on the long term, overdoing it with cleanliness and sanitization and might compromise the immune system. But yes, for the time being, hand washing is essential. Toss the toothbrush. When a child gets sick and is using a toothbrush, either throw it and get a new one because there will be some germs on the toothbrush, or sanitize it. And finally, the antibiotic part that I just explained earlier. I'm going to go over the sleep and the immunity quickly, and we're done. Yeah, this should be fine at the end. Okay, so sleep and immunity. All right, so we have stress hormones in our body. Those stress hormones are adrenaline and noradrenaline, also known as epinephrine and norepinephrine. Regardless, you don't need to know the technical names. They are pro-inflammatory. They increase inflammation in the body when we always have them, right? Now, their presence in our body affects the stickiness of, let's put it this way, the cells that are going to defend us, or what we call the T cells, okay? Again, T cells are part of our immune system. Just think of it of the line of defense, or the little armies that are going to defend us. Stress hormones make it difficult for this army to come and attach to a virus and defend us, right? Now, increasing stress, the increased stress in our life from work, from homeschooling, from whatever reason it is making it difficult for we call them the integrins, the ones that affect stickiness for the T cells. So it's affecting the integrins, so it's indirectly affecting our immunity. Now, it has been found that sleep puts those stress hormones to sleep as well, because when we sleep, stress hormone level decreases, right? Because this is when we generate happy hormones. This is when we take a break. This is when our cells repair. This is basically the most important part of our day when we sleep. Now, when we sleep, stress hormones decrease. Stress hormone decrease, it means the stickiness improves for the T cells, and we're giving them more strength to fight off those diseases. This applies equally to children and adults. Number of hours ranges by child age. I would say around 12 hours at least for children below 7 years old, and above 7-year-olds, 8 to 10 could be sufficient consistently. For adults, at least 7 to 8 hours of sleep. I'm not going to go over the relationship between cortisol or stress hormones and sleep deprivation and weight gain, because we don't have much time. I'll just give you an idea about some of the foods that might improve with the happy hormone production and suppressing appetite, and at the long term also improving immunity. So tryptophan, which comes from high protein food, mainly fish. Tryptophan is an amino acid: meat, fish, dairy, soy, nuts. Together with B6, magnesium, and B3 found in those foods, produce serotonin, which is our happy hormone. So basically the message here is make sure you're eating from all different food groups all the time to be able to, because it's not only about the function of this vitamin alone or this mineral alone. Most of the time it's a combination. You see this equation here, most of our body works this way. This plus this gives this, and this without this doesn't lead to that. So you have to make sure that you have a balanced diet in order to fill in all the gaps in whatever equation you're doing, in whatever hormone we're producing or enzyme we're producing, or whatever result we're looking at or disease we're trying to cure. Last but not least is activity, exercise for children and adults again. it has been shown that 1 hour a day of aerobic exercise or play, yani outside playing or running or doing activity outside, leads to an increased recruitment and secretion of anti-inflammatory cytokines, which again are the ones that help and enhance our immunity. There's a recent research that also showed that if you exercise for an hour, for 1 hour, a good level of activity, 24 hours before you get your vaccine, you also improve your chances of responding better to the vaccine and building a quicker immunity. This is just a table for you to for the timings of supplements. Again, I'm not going to go over it because this would also take time from us. I will wrap it up here and answer the question if there is any. Let me go over, let me just stop sharing this. All right. Oh, wow, okay, we have questions. Let's see. What's the easy way to lose fat? And what diet should I do in terms of immunity, I guess? How much caffeine? And between prebiotic and probiotic, which one of these two therapies, or maybe the combination of both, has been shown to be more efficient? As I mentioned, regarding, I will get to the fat loss in a bit. Regarding the prebiotic and probiotic, like I said, it's the symbiosis, the combination of both. And regarding, do you recommend taking daily multivitamin pills? Listen, this is a very good question. I personally don't like multivitamins taken haphazardly like this, just take a multivitamin. I always, when it comes to adults, I always prefer that we have a checkup, clinical and blood checkup, and see the deficiencies, and see the lifestyle, and see the diet, and see if there's any need really to take a certain vitamin or a certain mineral. And if there is a need, we take the vitamin that we need to take. Multivitamins are good in general in conditions where our immunity is compromised, like pregnant women, breastfeeding women. They need to cover up a range because maybe morning sickness, vomiting, whatever the situation is. Elderly who are less able to eat proper food, yes, we might be supplementing them with multivitamin. But for a young adult or child who eats normal food and who is active and doesn't suffer from any medical condition, I would rather we stick to targeted therapies rather than multivitamins. What's the easy way to lose fat? Well, this is a very complicated question. It's not easily answered in a generic way. Losing fat depends really on the person's body, on your activities, on your stress hormones, on your other hormones. So this is one of the things that clinical dietitians usually do in the clinic. We assess, we do whatever tests we need to do, and we discuss with the patient their needs, their lifestyle, their allergies, their intolerances, their work schedule, their sleep schedule, and based on that, we can give tailored programs that include a special menu, that include special macronutrient distribution, that include supplementation when needed, because yes, some vitamins and mineral deficiencies do lead to a weight gain. And some activities that people do might be leading to weight gain rather than weight loss. So it's really very, very personal and not that, not that generic, like I said. So I think this is it with the question. I'll wait for another few minutes. If anyone has another question, we can, I can address it. If there is no questions and we still have 5 minutes, just to take advantage of the time we have left, I could share some tips on some additional tips. Since we're at it, let me go over the vitamins and mineral that I was describing in a bit. So it is important to take supplements whenever needed, but it's also important to know the timing of your supplement. Taking supplements randomly throughout the day and not knowing the interaction between supplements and medications or supplements and each other could affect the absorption of those supplements. Especially nowadays, I know many people are taking supplements, and many people ask, what shall I take in the morning, evening, etc. This is a small chart I had prepared. So let's go over it, like from wake up to bedtime. Iron, for instance, is something that you take it with a source of vitamin C in the morning for better absorption. Probiotic is something that is optional. You can either take it before you sleep, but it has to be at least 2 to 3 hours after you've eaten, or first thing in the morning. That's because stomach acidity, if it's triggered by digestion, could kill the probiotic, and you won't be benefiting from most of it. Vitamin D is best taken with a source of fatty meal. So it could be breakfast or lunch or dinner, whatever your main meal is, take with it the vitamin D. Because why? Because like I mentioned earlier, because vitamin D is fat soluble, it has to be linked with a fat source in our food to be absorbed better. Don't take D at dinner, as it affects the body's production of melatonin and can disrupt sleep. Yes, we do recommend that, especially for people who have problems with sleeping. And if you've been taking your vitamin D in the evening, try to push it up to noon or morning. Vitamin C anytime between breakfast and lunch, but not more than that, because it could affect your sleep as well. If you have this is very important, if you have a sensitive stomach, take the buffered type of vitamin C, meaning a vitamin C that comes mixed with calcium, potassium, or magnesium, to make sure that you don't get irritated in your digestive system. Zinc, for those who are taking supplementation, don't take it on empty stomach, as it's strong and it can cause nausea, and separate it from calcium and iron pills. Magnesium, it helps in sleeping, so ideally take it in the evening. Calcium, take it in the evening, and avoid taking it with a source of coffee and tea, because caffeine limits the absorption of calcium. B6 is also very good for energy metabolism, but also promoting relaxation, and especially when it's with magnesium. B6 helps in mood regulation, and it's involved also in the production of serotonin and dopamine, which promotes good, healthy sleep. I think we're good now. I couldn't go over the lunchbox. I think this will need a session on its own. I hope you all benefited. Is vitamin D deficiency serious? Any deficiency is serious. Any deficiency is serious, because like you just saw, vitamins and minerals are really into all reactions in the body, and that vitamin D specifically is a pro-hormone. It's involved in the production of hormones in the body. So yes, deficiency is serious. Especially for children, it will affect bone development, of course, and calcium absorption, but also it has a big role played in immunity, and we should not overlook the deficiencies in vitamin D. And like I said, it's not only having the minimum normal 30 or 28. No, we have to have around 40 or 50 an optimal level. Vitamin B12 is not really related to specifically to immunity. Now, all of the vitamins and minerals are related, but it's mostly linked to neurological functions, to brain health. And yes, it's important to have it checked. There is also an indirect link with heart health. And this is, again, with a very complicated physiological system. But yes, it's important to have enough vitamin B12, and all the B vitamins are essential. And I think there's something I missed at the beginning. Cappuccino. How much caffeine in cappuccino? I'm not sure. I'm going to check I think it's around 40, no, not 45, around 60 or 70 milligrams. It's because there's a certain amount of milk with the cappuccino. So it's not like the black coffee 150, because a black coffee would be around 150 milligrams. So a cappuccino, I would say maximum 100 milligrams. Anyways, I hope I answered most of your questions regarding immunity. I will be leaving now. Thank you so much for your time. Thank you once again to the Health and Fitness Fun Festival and to the Abu Dhabi Center for Technical and Vocational For education and training to Abu Dhabi University. Special thanks to the College of Health Sciences and all my colleagues and the Dean of College, Dr. Wasim. See you soon, hopefully, and stay safe, eat healthy, exercise, and drink your water. Thank you.